Hi class, my name is Kayla Umari and this is my Asynchronous Group Social Work presentation. For my proposal, I targeted male foster youth ages 12 to 17 living in short-term residential treatment programs, or STRTPs, in Kern County, California. Foster youth are referred to STRTPs who have mental health issues, substance use issues, trouble coping with trauma, which has impaired their ability to maintain foster home placements. The issues that arise because of this are anger outbursts, aggression, violence, frequent interpersonal conflicts, and these usually stem from severe trauma faced before or sometimes even during foster care that can result in mental health disorders, substance use problems, and trouble coping with the trauma that they have or future trauma. California STRTPs provide intensive mental health and case management services to help stabilize foster youth and transition them to a lower level of care. And STRTPs are primarily funded through Medi-Cal and Title IV-E funding streams. The strengths-based approach that leadership development and anger management groups use have this approach because they reframe the name and context of anger management groups into leadership development groups. Reframing anger management treatment groups as leadership development groups may increase client engagement and also produce more positive outcomes. For the purpose of this presentation, LDG will stand for Leadership Development Group. Researchers like Farley and McWay from 2021 mention aggression is often facilitated by anger, and youth with a history of maltreatment and/or trauma exhibit higher levels of anger and aggression. Zastrow from 2019 says that anger management groups are one of the most common forms of treatment groups, and they are designed to find alternate ways of expressing and coping with anger, but also addressing negative outcomes that come with the unhealthy expression of anger. Some common topics that anger management groups cover include learning new forms of emotional expression and identification, problem solving, coping, and learning conflict resolution skills. Burt and colleagues from 2013 say leadership skill development helps reduce aggressive behaviors, reduce feelings of depression, increase academic confidence, and increase sociability in adolescent males. Leadership development groups promote the development of leadership skills while simultaneously reducing anger and aggressive behaviors. Group member teamwork is encouraged to help them focus group topics in accordance with the overall theme of leadership. The facilitator can use an indirect approach to discuss anger and other emotions by letting the members choose different leadership topics or leadership role models, and the facilitator can incorporate the various ways that anger can play into leadership skills and the characteristics of the leaders that they admire. Short-term treatment at STRTPs means that residents are admitted and transitioned out in what we'd call non-parallel schedules. So it differs based on, the month. Due to the misaligning treatment durations, the leadership development groups that are being proposed in Part B would be ongoing, and they would occur biweekly. Burt and colleagues from 2013 mention the Blanton and colleagues from 2006 model of meeting different group objectives. And so in order to be successful, a group must consist of an opening question, behavioral lesson, an activity, and then a closing, which is how I would model these groups. In the United States, 80% of foster youth experience significant mental health issues, and they also experience 5 times the rate of post-traumatic stress disorder compared to adults. Foster youth in California make up 14% of the 437,000 foster youth in the United States, making California the state with the highest number of foster youth in the nation. Since 2019, Kern County, which is where we are targeting in this group proposal, has seen an increase in youth entering and living in foster care. Foster youth also have higher rates of anger and aggression, and older youth are more likely to lose foster placements due to anger outbursts or aggressive behaviors. As foster youth get older or transition into adulthood, they're more likely to experience more severe mental health disorders, possibly homelessness due to unable to maintain placement as a teenager, and then possibly incarceration due to the untreated anger and aggression. For youth with mental health issues, anger management groups have been common among other anger-focused forms of treatment. School counselors in the past facilitating anger management groups found that typical anger management groups alone did not curb aggressive behavior in students. I found this quote interesting from the Burt and colleagues 2013 study. The quote comes from page 124. Furthermore, anger management groups have neglected the development of pro-social abilities and emphasized negative behaviors. However, when group facilitators promoted a strengths-based approach in contrast to the traditional deficit-focused approach, they experienced better outcomes. In previous studies, Burt and colleagues from 2013 also phrased these groups as leadership integration training groups, or LIT groups. However, I use the LDG acronym for leadership development groups. Leadership development groups utilize Bandura's social cognitive theory and the agentic determinant factors to discuss anger management in terms of leadership and the participant's environment. In one study on anger management leadership groups, Burt and colleagues from 2012 used Bandura's social cognitive theory combined with the 4 factors of an active determinant to increase social competencies. So they applied intentionality, forethought, self-regulation, and self-reflection, and the researchers uncovered significant decreases in anger and increases in the participants' leadership self-efficacy. The agentic perspective describes someone interacting with the world purposefully, who influences themselves and their environment, and also understands that they can be influenced positively and negatively. Bandura's social cognitive theory uses reciprocal determinism to consider how cognitions, behaviors, and the environment interact with each other. Evaluation of leadership development groups in an STRTP setting would use the Anger Management Leadership Scale developed by Blanton and colleagues in 2006. The scale would be used once a month to determine progress for each youth with varying treatment duration schedules. The scale measures anger management and leadership skills to identify any change. It's a self-report scale and can be presented in the closing portion of group sessions and analyzed by facilitators to identify participant improvement individually or as a group. Facilitators can encourage group discussion of leadership-related topics or skills that they find most interesting or helpful for future group sessions or ideas. Facilitators can also observe or collect data on other treatment outcomes to measure progress, like reviewing academic progress or behavioral reports, or obtaining reports from direct care staff in the facility on behaviors that they've observed. The leadership development groups would provide many benefits to the community of Kern County, California. Foster youth often lose housing placements due to anger outbursts, aggressive behaviors, or other behavioral issues. Providing youth in a residential treatment program with anger management and leadership skills could improve their ability to maintain stable placements in the future. Other negative outcomes associated with anger and aggression can include problems in school and social relationships, finding or maintaining employment, legal issues, and more. Currently, I intern at an STRTP for male foster youth, and one of the clients has been expelled and arrested for an incident involving anger and aggressive behaviors. Working on anger and aggression by reducing deficit-based conversations and using a strengths-based approach can build resilience and natural supports within foster youth and provide them with a more stable foundation for facing life's challenges.